Thank you for tuning in to our virtual coffee today. Our host is the Clara Barton Hospital and Clinics. We'll hear from them here in a little bit. Some announcements we have today is the chamber office will be closed to visitors, but if you need anything from Karen, you can send her an email or call her on her phone at the chamber office, and she can help you with whatever you might need with that. As you all know, Governor Kelly has issued a temporary statewide stay-at-home order in efforts to kind of combat this coronavirus so we don't get a whole bunch of people infected. If you need unemployment information, you can go to the website www.governor.kansas.gov. Places that are still open in our town here, the Dairy Queen is still currently open with drive-through, and you can call in orders too and just come through the drive-through and pick those up. The tap room is open for lunch only, curbside delivery. Mi Tierra restaurant is open for takeout only. Pizza Hut is drive-through and carry-out services through the window and delivery. The Cardinal Pharmacy is still open, but they have curbside delivery only. Town and Country is currently open. The Mule Barn, Casey's and Serves is open. There are also many more that are open, but please, before going into any of those businesses, make sure, and if they have protocols to go with, make sure you abide by those so you're not upsetting those. The Hoisington Library is closed, but you can check out their Facebook page for updates or anything going on there. USD 431, the continued learning program began this week, and I guess it's going as well as can be. Parents, you might want to just remember to please keep your children on a normal schedule through this uncertainty time. This will only help them, but it will also help them when they get back into school next year. USD 431 is also providing free breakfast and lunches for all kids ages 1 through 18. Meals are handed out at the drive-through at the middle school on Mondays and Wednesdays from 11 a.m. to 1 p.m. The transportation department has been delivering meals to kids who ride the bus to town. For Ministerial Association, once again, please check with your local churches for service information if those services are taking place or how you can get your services on Sunday masses. I know the St. John Church, they are been live streaming their services on Sunday mornings. The Concordia Lutheran Church has also been live streaming theirs to their Facebook page and website. And Emmanuel Lutheran will be posting videos on Sunday morning after with the service of the word on their Facebook page and website. The Clara Barton Foundation, some stuff there is if you want to stay current on what's going on with Clara Barton, sign up for their e-newsletter, Good Health, Good Works. You can get information about new items that's going on, announcements, health tips, and information on events and services that are going on at the foundation. Sign up through the hospital's website and stay tuned for more information.
Good morning, friends and neighbors. This is a little different format, but we're going to be giving you some updates from the city of Hoisington and on the economic development front. And as we all know, this is really an unprecedented time. We have multiple confirmed cases in Barton County, and so right now is a super important time to be patient with our local businesses, but find a way to support your local businesses and of course our Chamber of Commerce. If you've had the opportunity to get out and about in the community, you see a lot of organizations' offices are closed to the public. The city office is no different. We have closed the office to public traffic The trolley's no longer running. The playgrounds are closed to the community, and the Friendship Meal site has been transitioned to carry out only. But we are still trying to provide all the services that our community counts on, but it's different. We are interacting with residents less than normal. The council meetings moving forward are going to be held through Zoom until the stay-at-home order is lifted, at least until the stay-at-home order is lifted. And we'll still be posting information about them and how to make them accessible to the public. But if you're wondering what's going on with the city of Hoisington, you can check a lot of that on our Facebook page. And our friends at the Chamber have really worked hard to get the word out about other businesses and organizations in our community. And we would just encourage you, if you have questions about what's going on with the city, you can reach us, same hours as normal, at 620-653-4125. And I know it's a hard time, it's an extremely scary time, but we just want to remind you the good news about all of this, the stay-at-home order and the changes we're making to our personal lives, is that if we can all work on this together, we'll slow the spread, and our families and our community will be so much safer. And so let's do what we can to continue to stay safe, stay at home, and support local. Remember, we're in this together.
And now we will hear from the Clara Barton Hospital and Clinics.
Hi, good morning. Great to see you all today, although I'm actually looking at an empty chamber office with a few of our friends here, but I'm thrilled with Karen and the chamber and the board promoting a social distancing aspect here for the chamber coffee this morning. So I'm saying hello to you in a recording and wishing you all well. So I'm Jim Blackwell from Clara Barton Hospital, and we wanted to host today's chamber coffee and certainly share with you some of the information that we are getting on the COVID-19 pandemic that is gripping our nation right now, and as some of you may know, been positively identified as being received here in Barton County. So we're addressing those needs right now, and we have staff available here to give you some detailed information about what you can expect, and certainly what we're doing from Clara Barton Hospital's perspective to triage patients and make sure that we're meeting the needs, but also keeping everybody safe along the way here too. So I applaud our staff for all the efforts that they've made right now. Everybody at Clara Barton Hospital has really lifted heaven and earth to try to accommodate everything from our patient needs, but make sure that we stand ready and capable and available for you at a moment's notice, while also meeting the CDC and the federal government's request to purposely throttle back our business, our elective services, to make sure that we have enough protective equipment to be available at the time that we are most needed. So if I can introduce some of my staff and have them come on up and give you some points of interest this morning, I'd like to first start with Casey Beck. She is our infection control nurse and also involved in employee health. And again, Casey, you've done a tremendous job here with our organization. Come on up and give our community here a little bit of an idea of what some of the symptoms they might be looking for a COVID-19 diagnosis.
Okay, so I'm sure most people have heard that the main symptoms to look for are shortness of breath, fever, and a cough is also one of the main symptoms. And something that they can do, our community can do, to help prevent the spread of this and protect our staff is to make sure they call ahead or call our clinic staff if they have any questions or suspect that they need to be tested for this.
And one thing that I want to make sure that everybody knows, that if we are approaching somebody to test, it's kind of our standard guidelines, but they may come up with goggles, a mask, a certain protective face shield, and certainly the possibly a helmet or a gown to also protect in that regard. And I think as far as calling it ahead really helps us prepare the staff to be dressed appropriately when they go out there. Again, it's all about mitigation and trying to keep the spread of the disease, right? So yep. Good job on what you've done. Any other comments you want to add?
I don't think so. I know that we've had several calls as far as people calling to see if they can get tested if they're not having symptoms. And right now the state and health department are not really recommending that. They're not recommending to be tested if they're not having symptoms. So just kind of be mindful, of course, if you're having symptoms, because there would be no reason to test if you're not. But if you have a question on any of those symptoms or suspicion that you do, of course, call us and we can help answer those for
And
you.
of course, Casey would be saying this inside of our organization, but certainly on camera here too, and we echo what they're saying federally, but from the federal standpoint, but wash your hands. Be sure you practice those good standard hygiene, and I think that we'll all minimize the exposure risk here. So Casey, thank you very much. I would also like to invite Jane Shetman. She's our Chief Nursing Officer here, and Jane, I appreciate being a comrade in arms here as we're dealing with this, and great clinical direction from Jane with our medical staff as well as administratively at the hospital. So are there some points of interest that you would like to share with our group?
I'm sure that you all have heard about the shortage of PPE. So we have been working diligently to secure that PPE starting probably about 6 weeks ago. We feel like we have a good amount, but we are working to conserve that. So we will not always be offering masks, and we don't have those just available at the front door for anybody. Rather, we're trying to hand those out to those folks that we feel are a risk. PPE, if you come to us with a cough, fever, etc., we're going to put a mask on you. Once we get you back to the room, then we will come to you fully dressed in PPE to take that specimen that will be sent away to the state. It's been 24, 48, 72 hours before we do get the result. We're working hard to keep the hospital a safe environment for both our patients and our staff. For that reason, we went to no visitors at the first of the week. When the first case in Barton County was identified, we went to no visitors. We felt it was very important to control the environment. We are offering to our patients to be able to talk to family by phone. We are trying to work to get FaceTime available for our patients. And just this afternoon, we're numbering our rooms on the outside of the windows so that family may come to the windows to visit their loved ones. We've done quite a bit of staff education internally. We're looking to, or we're preparing to care for patients that are more critical than what our normal clientele is. We're also working to get our patients home that can be home so that we aren't putting our patients that may have comorbidities, aren't putting them at risk of this organism should we have it in the hospital.
And that's not meant to be an inconvenience, and we apologize for that. If you're trying to come up, see a loved one with the no visitor policy and the mitigation that we're doing in our clinic settings to try to reduce the amount of people coming into the organization, one, to comply with federal guidelines, but also to mitigate the exposure and the spread of the disease. But the one thing that really is exciting for us that we did want to share in this regard is our expansion of telehealth services, and we're really getting that ramped up right now. And Cerner is our electronic health record, and they have been a terrific partner. And once I sign the contract on that, we'll be deploying the Cerner application for our telehealth services within about a week and a half at this point in time. But presently, as of today, we have another option that will allow us to make that availability at this time. In fact, our medical staff is presently using this. So if that is an option for you and that it works, our goal is right now to take care of patients and try to minimize the amount of traffic coming in the front door. So that's really good, and I appreciate that. But boy, if you talk about shortage of personal protective equipment, if you've been to the grocery store, it's not just carrots, it's not just potatoes or toilet paper, it's also the stuff that's protecting us. And that's unfortunate, but really when you think about the supply chain in the entire United States, when everybody's being asked to shut down, you know, that affects all supplies across the line, especially the hospital guided supplies. It's real, we have adequate stock, but the problem is getting it back in when we reorder it. So that's where our concern is right now. And actually another point to bring about that is the thrilling part is we're actually having masks made right now with a 3D printer by local friends of ours. That also can be used with an interchangeable N95 or a MERV 16 HEPA filter to help us comply with that and preserve some of our products. So that's just if we end up running out completely. In the event that we don't get resupplied, we have a fallback plan. So
We're getting very creative. I think the hospital, we're at a little bit of an advantage because we know when we're suspecting COVID-19. When you're in the grocery store or you're about town, you need to keep that in mind. The hand washing is extremely important. The social distancing is extremely important. And you can help us flatten the curve so that we have ample PPE to take care of everyone in this community should we need to.
all right.
Okay.
Jane, thank you very much for your time here. And lastly, I'd like to invite Sydney Rugen up here, our communications expert, and she does a good job of trying to get all the information out to you folks through our social media platform and any of our advertising to communicate consistently our message throughout the organization. And as you can imagine right now, it's a message that really is changing very, very rapidly throughout all of the nation. So, Sydney, are there any final points that we need to make to everybody today?
Just a couple other reminders for you guys. We are no longer doing walk-in clinic at our clinic locations. So all appointments will be made, or all visits will be made by appointment. So be sure to give them a call if you're wanting to be seen, or obviously take advantage of the telehealth options as well, so you can be seen in the comfort of your own home. Also, there's no walk-in lab draws at our clinics. You can get your labs drawn at the clinic via appointment, but we aren't going to do walk-in. You can still come to the hospital to get your labs done. So just wanted to clarify that. And then if you would come to the hospital to have a lab drawn or something, you will be screened at the front door. Please stop and give them a little time to ask you a couple questions. They'll make sure you're not having symptoms. They'll take your temperature. That way we're protecting both you and the rest of the patients and the staff in the facility. So I miss seeing you guys all here, but hopefully we can take care of this and be back together soon. So.
That's a great point. We miss seeing you at the hospital, and we look forward to getting back at that. But until then, socially distance, wash your hands, get to-go food at Dairy Queen and Pizza Hut and all of our friends, and our hospital also anybody there that has needed food is still open as well. So.
And you can call us at Clara's Corner Cafe and place an order. Just call us when you get there and we'll bring it out to your car. So we still do offer to go.
Yep.
So, and if for any more information, we do a updated list every day of all the changes and happenings at Clara Barton Hospital. You can find that on our website at www.clarabartonhospital.com. We're also trying to keep our Facebook page updated, as well as Great Bend Post and stuff like that. So definitely check that out for more information.
Very good. Thank you. Have a great morning.